Hello friends, let us now learn some previous year questions. All are true regarding laryngeal mask airway except big oral tumor is contraindicated for its use. Yes, because we put the laryngeal mask airway through mouth. If there is an oral tumor, then you cannot put it. May be used when intubation with endotracheal tube is not possible. Yes. Can be used in child's eye surgery. Yes, and it can be used for CPR also. Laryngeal mask airway can be used in all these conditions, but always look for aspiration because there is increased chances of aspiration in laryngeal mask airway. Next question. Which of the following circuit is preferred in child with spontaneous ventilation? Spontaneous respiration, Mapleson A is preserved and Mapleson D or Jackson-Rees circuit is preferred for controlled ventilation. Okay, next question. Weaning is generally done by, sorry, this is not Jackson-Rees, sorry, Mapleson D. Mapleson D you see is controlled ventilation. Mapleson D or Bain circuit is controlled ventilation. Jackson-Rees method is for pediatric ventilation, which is Mapleson F, which is for pediatric ventilation. Next question. Weaning is generally done by synchronized invasive synchronized mandatory ventilation. You can do weaning can be done. Continuous positive pressure ventilation, positive airway pressure ventilation also you can do weaning. In pressure controlled or air controlled or controlled mode of ventilation, here you are controlling the respiratory rate or you are controlling the pressure. So in such conditions you are giving the patient the required amount of pressure and respiratory rate from externally. So this in these methods the weaning is not possible. Weaning is only possible with synchronized intermittent mandatory ventilation, or it is also positive with continuous positive pressure airway pressure ventilation. Then next question. Child on immediate post-operative care is complaining of nausea, vomiting after squint surgery. Which of the following drug may not be used during the operation in controlling this symptom? Okay, there is nausea and vomiting. So which of the following drug may be not used during surgery? During surgery actually we should use one of these drugs for controlling nausea and vomiting, but these were not used, and that is the reason why the child developed nausea and vomiting. So ondansetron will be used for nausea and vomiting, and we can also use drugs like propofol. It has decreased incidence of nausea and vomiting, and even dexamethasone can also be used to control nausea and vomiting. Post-operative nausea and vomiting, you can use these three drugs. Next question. Which of the following fluid is used in perioperative period is isotonic? Okay, Ringer lactate, 5% dextrose and normal saline are isotonic. This is hydroxyethyl starch. This is also isotonic. Hydroxyethyl starch. This is also isotonic. DNS or dextrose normal saline is actually hypertonic solution. Okay. Thank you for watching.